What are the medications for an embryo transfer? So if you are doing what we call a medicated cycle, you will be taking estrogen oral tablets. There are other formulations of estrogen as well. Sometimes we use injectables or estrogen patches, which go on like a Band-Aid, but the typical formulation is an oral tablet. And then once we get to the point where we're ready to schedule your embryo transfer and we want to mimic your natural cycle and mimic ovulation for the actual insertion of an embryo, we use progesterone. And this progesterone, it's progesterone in oil. Again, it could be found in different formulations. Sometimes people do vaginal suppositories of progesterone, and sometimes they take oral tablets, but the most commonly used formulation is the progesterone in oil injection, which is injected intramuscularly in your buttocks. Some of the other medications that you could use for an embryo transfer, depending on your clinic and depending on the protocol, are Lovenox, which is a blood thinner. Sometimes people use vaginal Viagra. There are other supplemental medications used for a medicated embryo transfer cycle, but the two most common medications are the estrogen and progesterone. What are the side effects of progesterone? Progesterone in general is thought to be more of a happy hormone. So we don't hear much about the progesterone unless someone is taking the progesterone in oil intramuscularly, in which case we do see patients with muscle soreness from the thick oil formulation of it. And then in terms of estrogen is always the most hated hormone. Estrogen is kind of what makes us feel crummy. It can have an effect on your skin. Some people call us and say that they have acne in response to estrogen. It can cause breast tenderness. It can cause headache, bloating, nausea. So estrogen definitely does more in terms of side effects than progesterone does. Postpartum depression, like, people don't realize a lot of it is hormonal. Your placenta is full of progesterone, and we just rip progesterone right out of your body. So your progesterone goes from here and it just plummets. And so that's a whole piece of postpartum depression.